AIDS, which stands for Acquired Immunodeficiency Syndrome, is the most advanced stage of infection caused by the human immunodeficiency virus, HIV. HIV attacks and destroys specific cells of the immune system called CD4 cells, or T lymphocytes, weakening the body's ability to fight off infections, illnesses, and certain cancers. As HIV progresses without effective treatment, the immune system becomes increasingly compromised, leading to AIDS. AIDS is diagnosed when the number of CD4 cells falls below a certain level, typically less than 200 cells per cubic millimeter of blood, or when a person develops one or more specific opportunistic infections or cancers associated with HIV. Without treatment, HIV typically progresses to AIDS over several years, but early and consistent use of antiretroviral therapy, ART, can prevent this progression and help people with HIV lead long, healthy lives. The causative agent of AIDS, acquired immunodeficiency syndrome, is the human immunodeficiency virus, HIV. HIV is a retrovirus that primarily attacks the immune system, specifically targeting CD4 T cells, also known as helper T cells, which are crucial for the immune system's ability to fight infections. As HIV progressively depletes these cells, the immune system becomes severely weakened, leading to AIDS when the body can no longer defend itself against opportunistic infections and certain cancers. HIV is transmitted through blood, semen, vaginal fluids, rectal fluids, and breast milk from an infected person. Common routes include unprotected sexual contact, sharing of needles, and from mother to child during pregnancy, childbirth, or breastfeeding. AIDS is the advanced stage of HIV infection, characterized by a greatly reduced number of CD4 cells or the presence of specific opportunistic infections or cancers as a result of immune deficiency. HIV is the only established agent that causes AIDS. The epidemic in India is concentrated in specific high-prevalent states and vulnerable groups, not generalized across the full population. 44% reduction in new infections since 2010, outperforming global average reduction rates. Free ART is widely available through government centers, and treatment access continues to expand. Main mode of transmission remains heterosexual contact, followed by injecting drug use, especially in the Northeast. Regional prevalence can be much higher: Mizoram, 2.37%, Nagaland, 1.44%, and Manipur, 1.15%. Global, 40.8 million people living with HIV worldwide. Highest burden is in sub-Saharan Africa. South Africa and Nigeria have the highest numbers of PLHIV. South Africa's adult prevalence exceeds 20%, much higher than India's. Global prevalence is about 0.8%, but some countries and regions are much higher. AIDS deaths and new infections have declined overall, but progress is uneven. United States and other regions. Adult prevalence in the US is low, 0.3%, but concentrated epidemics exist among certain populations. Countries like Thailand, Brazil, Russia, and China also face significant HIV epidemics, mostly within particular risk groups. India has the third largest absolute HIV-positive population globally, but its adult prevalence rate is much lower than in sub-Saharan Africa, 0.2% compared to over 20% in South Africa. The epidemic is concentrated in high-risk groups and certain regions, not generalized nationwide. States in Northeast India, such as Mizoram, show regional prevalence above 1%. Sub-Saharan Africa remains the worst affected region, with more than 60% of the world's HIV-positive people. The region also records the highest adult prevalence rates and AIDS-related deaths globally. South Africa has the largest national HIV epidemic, with a prevalence rate exceeding 20% and about 7.5 million people living with HIV. Globally, new HIV infections and AIDS deaths are declining, but progress is uneven, and children/adolescents in many poor countries remain at particular risk. The United States and most high-income countries have low overall prevalence, but face concentrated epidemics within specific risk groups. Takeaway: while India faces a high HIV burden in total numbers, its population-wide prevalence is low compared to countries in Africa. India has also seen a significant decline in new infections and improvements in treatment access over the last decade, setting it apart from the crisis levels in some African nations.